Welcome to the Lean Blog Podcast. Visit our website at www.leanblog.org. Now, here's your host, Mark Graban.
Hi, this is Mark Graban. This is episode 182 of the podcast for July 30th, 2013. I have a really special and interesting episode today. My guests are Michael Grogan and Dr. Brenda Dmello. They're joining me via Skype all the way from Tanzania, where they're working together to use lean methods to improve healthcare at a health center called CCBRT. Michael, as you can tell from the accent, is Irish, and he left his career in the United States to come work in Africa with Dr. Brenda, who is relatively new to lean, and others. They're doing really important work. I think it's a really important mission. And I think it's interesting to hear about some of the organizational and cultural challenges within the organization. I'm not talking about national culture, but organizational culture, how familiar this might sound, talking about things like developing leaders, stopping blame of individuals, treating people with respect, eliminating a culture of fear. These are things that, as Dr. Brenda points out, are needed beyond clinical skills alone to be able to solve the problems that we're facing in healthcare. If you'd like to read more and see a video of Michael and Dr. Brenda talking together, if you'd like to donate to their efforts via the Capona Foundation, which is a U.S.-based organization, you can go to leanblog.org/182. You can find links to learn more about their organization and their work. And if you'd like to get involved and help out in some way, you have hopefully opportunities to do that. So I hope you enjoy the conversation. And for all podcasts, you can go to leanpodcast.org. Thanks for listening. Well, Michael and Dr. Brenda, thank you so much for being guests here on the podcast today.
Thank you, Mark. It's a pleasure to join you here today.
Thank you, Mark, for having us.
Well, it's my pleasure. It's very happy to have you be able to share your stories and what you're working on today. It's a real honor to have you here. Michael, if you could start first, if you can introduce yourself and some of your background with Lean before we get into the work you're doing there in Tanzania.
Yeah, sure. So my name is Michael Grogan. I'm a Lean practitioner and coach here in Tanzania. How I came to Tanzania is a great story in itself, but maybe my introduction to Lean was in the 8 years I spent with a large pharmaceutical company. I spent about just under 3 years in the UK and just under 4 years in the US. So I worked for a Merck pharmaceutical company, and I was in that time that I got exposed to lean thinking. So I did my Lean Six Sigma qualifications back in 2009, the black belt and whatnot. But I believe my greatest exposure was when I got coached for 2 years by a lean sensei, Eric Hager, and Eric has spent 13 years in working for Toyota. So getting pure TPS coaching, it kind of revolutionized the way I think. So I'm consider myself extraordinarily lucky to have been exposed to this thing called lean.
Yeah, and I know Eric, and gosh, maybe I should have Eric as a guest on the podcast. I've had a chance to talk with him, and you're right, that was some excellent coaching, great opportunity that you had there. Let's talk a little bit more, and then we'll come back to Brenda about some of her background and perspectives on getting introduced to lean. But Michael, maybe first, if you can talk about how you ended up doing the work that you're doing today. How did you end up there in Africa?
Well, my short answer is fate, but it is quite interesting how I ended up here. And if you were to ask me this question 3 years ago, that I'll be working for a healthcare provider here in East Africa, I almost wouldn't have believed it. My exposure to Africa was when I lived in the UK. My roommate was Tanzanian, and he invited me to his sister's wedding. So, having been a child of the Western world and never left Europe or North America, I thought it was an opportunity, a once-in-a-lifetime opportunity. So it was in that vacation, that 2-week vacation, that it went from being a tourist to something else. And it was in that time, in April 2010, it's the first time I came face-to-face with people, especially children and women living in extreme poverty. And on the return trip back to the US, I remember reflecting to myself what I saw and the stories I heard and the people that I met, and it was shocking at the same time, but I did not want to be one of these Westerners that come to this part of the world, see it, and it's all talk and no action. So on that day, I made a promise to myself that I don't know how I'm going to help. I don't know who I'm going to help. I don't know exactly in what context I'm going to help. But whatever I do involve myself in, it must make the biggest possible impact. So about a year went by, and I volunteered in what I would consider traditional philanthropy. So I connected with an organization, and I raised funds for that organization in girls' education. And in a way, I challenged myself, am I doing the biggest possible impact? So I looked for organizations in Tanzania. I wanted to return to Tanzania, but this time, I guess, to use the talents that I was been lucky to have the opportunity to be gifted with, or the opportunity to learn. And that's when my colleagues said, well, Michael, don't you teach this lean stuff? Why don't you go out to Africa and find an organization that you can coach? So it was a kind of eureka moment for me after a year of doing traditional philanthropy. And so I threw my resume out there, threw a description of what I wanted to do for 2 weeks of my vacation. And through my connections, my documents got in front of the CEO of an organization called CCBRT. And the CEO responded saying he would be delighted if I come to his organization. I never heard of this organization, CCBRT. But when I read about them and I found out the work they do, serving the poorest of the poor, both in terms of disability and maternal health care, it was like falling in love. It was said, this is exactly the type of organization that I want to volunteer for. So I volunteered for 2 weeks. I did 2 weeks of training, albeit death by PowerPoint, problem-solving training. But it kind of introduced them to it, and they got really excited by it. So I got offered right there and then to a full-time position, but if I'm honest with myself, I was scared.
Yeah.
I love my life in the US, and to quit everything and move to Africa, I wasn't ready for it, and all these unanswered questions. So I said I'll test it again. So I came back again at the end of last year, this time for 5 weeks. I took some time off work as well, and I brought a colleague of mine as well, another lean coach, for 2 weeks. And it was in that time that I think it was on day 2, I decided this is for me. And why I said this is for me, because it felt like the most meaningful work I've ever done. And that's no disrespect to my professional career in both the US and Europe, but just the job satisfaction I got out of these people that I met were so hungry for this knowledge. And it wasn't like I was telling them how to solve their problems, but teaching them the method on how to solve their own problems. And what I witnessed in my time here, and Brenda is a testimony to that, the people I met and the people I coach here, they're more talented than me. I don't underestimate that at all, but they didn't have the same learning opportunities than me. And this is all about developing them, using the lean principles of the lean thinking so they can solve their own problems. And that meaningful work of serving the poorest of the poor and knowing that this is a long-term approach, I just could not let go of that, if you will. And I really believe to this day, and I went back to the US and I quit my job and I moved here full-time at the end of February. But I feel that the people of Tanzania and Africa have taught me more than I could ever teach them, and I don't know how many years I'm going to be here, but just that the definition and that perspective, the definition of success and that perspective. So it's the most rewarding work I've ever done in my life, and I feel honored the opportunity to come here on a full-time capacity and to coach.
Yeah, and you say you're not sure how long you're staying. That's kind of up in the air.
I'm here for 15 plus years. Don't tell my mother that. I guess my own family were like, what are you doing? No one can tell the future. If I'm here for 15 years, for 2 years, 10 years, I don't know. I thought I'd be in America for a lot longer. I thought I'd be in Ireland. I'm from Ireland. Right. I thought I'd be living in England for a lot longer, and I stayed 3 years. But you never know. But I believe that I'm here for the foreseeable future until otherwise. But I'm committed to because there's so much human need here. Mm-hmm. I want to lead by example, and I want to be on the ground and supporting Brenda in the heroic work that she's doing, and to share them with the opportunity. And this thing we call lean, I feel so lucky to have been exposed to it, and it's almost like an obligation that we need to share this powerful philosophy and practice of continuous improvements with people that can make a significant difference on the quality of human life. Yeah,
I think that's very powerful, and we'll kind of dig in a little bit to what you're working on. But maybe let's turn things over a bit to Dr. Brenda. If you can introduce yourself and your background, and maybe also talk a little bit about CCBRT?
Thank you, Mark. So my name is Dr. Brenda Dmello, and I'm a Tanzanian doctor. I qualified in my general first degree in 1990. And I always knew that I wanted to work with women and children. As Michael pointed out, the need here in Tanzania is great. And I think especially in the sphere of maternal and newborn health, there's plenty to do. Tanzania is one of the top contributor to global maternal death, and one of the fourth highest contributor to neonatal death. So it's on the top 10 list in spite of being a country at peace. So what it does tell you that we have a lot of work to do. It's a health system that is crumbling and overwhelmed. And much of what we need to do is very out there. And working in the field of healthcare has a sense of deep satisfaction. So I qualified as a specialist in 1999. And I was convinced that if I could train doctors and postgraduates, which I did for about 7 years, I would revert that situation and would drop us off the top 10 list. Mm-hmm. And very diligently, I did all I could. But every 2 or so years, I would give the lecture on maternal mortality, and it would make no impact. We were significantly, the numbers of deaths were not changing. We didn't move from the top 10 list. And then I came to the realization that this is a public health problem. I need to humble myself and stop the zeal of clinical work and modify my approaches to a more public health setting. So since I'm really, really lucky that the opportunity came up at CCBRT. A little about CCBRT. It's a national disability organization. So it provides surgical care for correcting disabilities, treatable disabilities like cleft lip, clubfoot, cataracts, and fistula, obstetric fistula that is caused from prolonged and delayed and neglected childbirth. So for the past 10 years, it has been one of the main disability organizations in Tanzania. And in 2010, the organization did a shift and started moving towards prevention of disability through initiation of a maternal and newborn initiative. And I was called in to help develop and implement that initiative, which to me was a dream job. It still is, because I felt like right now we had funding from the European Union and CBM. I had my relationships with the Ministry of Health. I was working with the Ministry of Health. We're working in a region of 4.5 million that conducts 100,000 deliveries. 16 of those deliveries were directly under our project. So we had the opportunity to influence 80,000 deliveries, which I thought this was great. And I think my introduction, I think this is really relevant because I used everything I had, all the knowledge, all the skills, evidence-based research, Columbia's maternal mortality reduction scheme and John Hopkins, and tried to implement every evidence-based best practice that I did. Mm-hmm. So when Michael met me last year, I was just about kind of losing wind because we had tried everything we could, and there was still something missing. There was improvement, but it was so marginal, 10%, 2%. It was really discouraging. And so when I met Michael, I was at that point, I was searching for an answer of something to add to this beautiful program that we have developed that would make this significant jump and make an impact and really reduce maternal and newborn deaths.
And it's such, it's hard to, without understating it, what important work it is that you're doing, what important challenges you're facing. Dr. Brenda, what were your first thoughts about lean as you were exposed to lean as a methodology? I'm curious to hear some of your early reactions or current thoughts about the role or the expectation that you had that lean could play in improving care.
So when one of the first, I think the growth has been really gradual, and even the word lean, I just stumbled. I think as I learn more about it, I'm falling more in love with the whole principles and practice and the methodology. But when I first heard of it, there was something that Michael said. He said, everything rises and falls with leadership. And at that time, I was analyzing the standards at 9 of our highest volume sites. And there was one particular site that stood out. And everyone else was at 30% of the standards, and this one site was at 70%. And when I looked at it, it was the management there, that they were engaged and they were problem solving, and they were just amazing. And so I spent a lot of time looking and learning from them. So when Michael brought in the leadership thing, I thought, yes, this is the key. This is what we need to do. And so I was listening to him with all intent, because I knew that there was something I needed to do, but I did not know what to do with the managers, because I had trained them with all the clinical skills I had. We'd done some management training and quality improvement. And I must admit that I actually read the Toyota QI method, in quality improvement the Toyota way, an article on the web in 2010, which inspired me to introduce standards-based management. But what I got from the article is a fraction of what I'm getting from Michael. So, it's just golden nuggets that make so much sense and resonates with, the truth that I have. It's taken me 22 years to discover some of these messages. And I don't think that it's ethical to allow change to happen so slowly. So once you know these principles, we are actually responsible. Because I wouldn't we need the principles. We need to implement what we're learning, because the impact will be far more. So I tell Michael, if I had known this 2 years ago, I think we could have been way higher in achievements of what we wanted to do. But there's no point in regretting. I think we need to move forward and try and see. So what is coming to me is, as I learn and I see, the logic of the principles, they just make sense. And everybody, as soon as you hear it, you say, you knew that, but it didn't sound this clear. We didn't know exactly what to do next. And that's an exciting time, because you feel personally and professionally, I feel like inside me, my mind is growing, I'm developing professionally in a way that I'm quite proud of.
Well, that's really great to hear. And Michael, let me turn things back over to you to talk about leadership and management, as Dr. Brenda mentioned in your blog post that you wrote about your first 79 days. You talked about developing leaders. Can you talk about that a little bit in terms of the principles that you're teaching to people, the impact that different leadership style is having? What are you experiencing through this?
Yeah, sure, Mark. So my initial on this lean journey for CCBRT, and just to give it an idea of numbers, it's about 400 staff, and we expect to, in the next 2 or 3 years, to go to 1,200 or something like that with the new maternal hospital we're building. So of those 400 staff, I'm almost exclusively focused on developing the senior management team, the senior leaders in the organization. We spent a lot of time in workshops, one-on-one, but emphasizing to them that this lean thing is not me, but it's them. They are the teachers of the organization. They are going to be the teachers of this, not me. So at the moment, I'm bringing through formal problem-solving classes, which is, it's 35% training, but the rest is all doing. And the expectation is that they become the trainers they become the coaches for their own colleagues. Mm-hmm. So I'm very much, and even I had a session today on problem solving, and I got them to give the feedback to each other rather than coming from me. So I'm spending a lot of time one-on-one with managers, trying to create the picture for them what a lean leader, how a lean leader thinks, acts, and reacts. So there's a lot of excitement from them, and the engagement from the CEO and the deputy CEO is just fantastic. In a way, there's some of my best students, so that they really grasp that they're the ones responsible for driving this through. And I think if I didn't have, it would have taken something. I was very happy in my previous company, Merck, and I always said to myself, it would have taken something special, a special organization to leave. And I feel within CCBRT and the commitment I got from the senior leaders, from the director of the hospital to the CEO, to the head matron, to the head of finance, they're really excited about this. And words are, I mean, everyone can make great speeches, but we're beginning to slowly see that in their actions. And I always say, don't judge a tree by the fruit that it talks about, but the fruit that it bears. And in time to experimenting with these new habits, I mean, just the one habit of like go see, that's totally, in so many ways, so new to them. But it's so delightful to see how they're experimenting with this, and they're seeing the benefits, and they're becoming their own champions of this. And they're even making fun of me sometimes with the repetition and the questions I ask in terms of what assumptions, what are standards. And that's fantastic to see them asking those great questions. And it's, I really feel, and this has not been driven by ego, that this organization here in Africa, in one of the most poorest parts of the world, we can make history here by becoming one of the first organizations, first healthcare provider on the continent of Africa to begin this lean journey and to have extraordinary success. And I keep on telling the leaders that we can be a shining light for all the other healthcare providers in the area. We can be the Pedicare, the Virginia Mason, or whatever you want to call us, but people can come to us and we can be a learning academy, if you will, and we can spread this lean thinking across the continent, starting here in the city of Dar es Salaam in Tanzania. So my excitement of working with this senior leadership team, it gives me so much energy and enthusiasm that I want more people, your listeners including, I want them to experience this themselves. So it's great that we're talking, but there's no substitute, as you know, for go see.
Right. Well, and there's no substitute for action, because I know you're taking action and inspiring others there locally to take action. Dr. Brenda, maybe to turn it back over to you, because you've been learning from Michael and being mentored, coached by him, and working together. Can you talk about an example, specific example of something that you're doing differently, or a process change that you've been involved in that's been meaningful?
Yeah, there are many examples. I think what is important to explain is that the work at CCBRT is actually threefold. We have a disability hospital, and we have a community program, which is what I mentioned earlier, which has public health facilities that are sponsored by the government, but supported by CCBRT. And here in Tanzania, healthcare is provided by the government for free. And in the pipeline, in the next 2 years, we are building a new maternity hospital that is scheduled to go live in early 2016. So what we're doing is learning, piloting, and hoping that the new hospital will imbibe all these principles of lean and actually save a lot of wastefulness that we're doing. One of the important things I learned from Michael is what we've done is in the community, we've taken our 3 biggest sites that do 22,000 deliveries a year, and we've taken the key decision makers and the most influential people, and we've trained them in the first round towards what Michael calls the yellow belt. And we are encouraging them as part of this capacity building to become problem solvers. What was really, really interesting is that for many of them, they're senior managers working in the system for 10, 15 years. It was the first time they actually donned on scrubs and worked the labor ward. And the change that made, both to the staff that work under them and to them, was electric. And there was a whole newfound respect. There was an empowerment of people. Just that process of going and seeing and drawing a process map. It was the first time we were excited to see problems, because the whole process map was like little red bulbs shining, and they were all little problems, really, really easy, that we could now see. And we couldn't just wait to get our teeth into them. And the Michael was, no, you got to get everything, get the facts and figures, no assumptions. He was keeping us on stage 1 of situational analysis until we really humbly acknowledged how much we hadn't seen before, how much waste was there, how much simple, really, really simple things we could do with almost no resource. And that was a great moment for me, great moment for them. And that was worth so much more, because I couldn't, I could teach them to do a cesarean section, I can teach them to do a normal delivery, I can teach them to save lives, but eventually it's a system that needs to support the technical person, and that's where we've traditionally failed. So for me, just the power of the go see and imbibing each and every step of the way has been really valuable.
Well, and that seems so, hauntingly familiar, to healthcare in North America and Europe, to hear about the impact of systems, the need for systems, in addition to the clinical care. So, Dr. Brenda, it sounds like you're optimistic that having more of a focus on process improvement and better systems will hopefully have a great impact.
Absolutely, absolutely. I mean, I think that the principles of lean are actually an essential component of any capacity building program. Clinical care alone, clinical skills alone will not lead the capacity for the leaders to be able to solve their problems in a sustainable way. So for me, that is the take home I get, is that it has to be at least in some way or the other included and incorporated into any capacity building exercise.
Yeah, and it would be great to hear more about how that improvement work is developing, and I would definitely love to talk more about your progress in future podcasts. Michael, one other thing I wanted to touch on a little bit, because you mentioned this in your blog post, and I think this is another very universal part of the universal human condition, to talk about leadership and not blaming individuals. Can you talk a little bit about that from your experience in the past, or what you're seeing now? Why is that an important part of lean leadership?
Oh, it's a fantastic question, Mark. When people ask me what's my favorite lean principle or practice, it's hands down, it's respect for people, and that deep understanding, deep meaning of what that really entails. Not just verbal respect, but in terms of respect in terms of your actions, how you think, act, and react. So I'm a huge student of Stephen Covey's work and Dr. Deming, but seeing it in practice, it's so important for leaders to recognize the consequences of their actions, of consequences of their decisions. And a lot of the training I do, and just as how I was trained, is to get managers and leaders to reflect on how they interact with people. So I always tell them in problem solving, you can forget everything I taught you. I'm okay with that, but don't forget this, the importance of go to the process, observe the process, and talk to the people who do the process by showing respect, by asking why, and to find out more. And that's the thing I always want them to, and sometimes they make fun of me because I repeat it so many times, but I'm okay with that because that principle is so important. And there is the culture of fear, and I know, as Dr. Deming said, if there's a culture of fear, you'll never get the truth. And if we can get that, if we can just make those small wins and get the leaders to reflect on it, it's tremendous. And I know Brenda can share testimony of, they're talking about only last week in our training. We want to share this one, the punishment.
Yeah, there was a bad outcome, and one of the leaders there wanted to send a letter. Is that wanted to send a letter? Usually when you do something wrong, you get a letter, a warning letter, and as we discussed, we had the other members of the group asking this person, so what will that do, and how will that prevent the problem from recurring? And it's amazing how among themselves you could hear Michael's voice, is that going to stop the problem from recurring? And Michael didn't have to say a word. Among themselves, there was peer learning. And this whole little action item of punish the person for doing the wrong thing, for not filling this paragraph, it went from, it went across the quadrants, the priority matrix. And then sometimes it went off, and then the person would bring it back on. And it was really interesting for them to question the value of punishment or the lack of value of a warning letter, rather than looking at the system. But this is an exciting time, of growth and change, and changing thinking, changing traditional mindsets of how we do healthcare here. Yeah, so I really thank you, Michael.
No, thank you, my teachers. It's taught me.
Well, it's great, Michael, that you're able to pass along what you've learned. It's really really inspiring to hear about what y'all are working on together there in Tanzania, and hopefully we'll be able to stay connected and keep talking about what y'all are learning and doing and your important work. Michael, as we wrap up here, I'm sure a lot of people listening are wondering what they can do to help in one way or another. If you can talk about that a little bit.
Yeah, sure, Mark. I guess on a personal level, speaking directly to our listeners, a lot of people have come up to me and asked me about the personal sacrifices I made to come here. And it may appear that I'm quitting a great career with a big company or a lifestyle that I had in America, but I look from the perspective I've won so much, I've learned so much, and I thank God every single day for bringing me here to serve these amazing people. What I mean by this, the African healthcare system is the greatest humanitarian crisis in the world right now. There is nothing more heartbreaking and creating so much harm and unnecessary preventable death than the African healthcare system. And we can go around pointing fingers and blaming the lack of resources, but I wholeheartedly believe the single greatest intervention we can make is in the development of people on this thing we call lean. This, the greatest improvement methodology ever invented, if you want to use that phrase. Mm-hmm. So I'm asking listeners that we need help. I'm only one coach. The demand for this is so overwhelming, but the supply on the ground is so small. So my direct request is, and I know maybe this is only appealing to 0.001% of the population that are able to do this, but I want people to consider to come here, whether it be for 2 weeks or 3 weeks or maybe a month or they can, whatever time they can dedicate to come here on the ground and help us. We desperately need to convert, I'll use a phrase Mike Stockline taught me, moving butts on the seat to boots on the ground. There's a desperate need to get more lean practitioners here in the field, working side by side with heroes like Dr. Brenda and trying to reverse these heartbreaking maternal and neonatal deaths. So number one, if you were to ask me to prioritize, I want people here, practitioners in particular, if possible, to develop leaders, develop managers to the long-term solution. Number two, if that's not possible, I know that's probably not possible for 99% of your listeners, can you possibly help us spread the word? I'm so grateful, Mark, and I know we've talked in the past about this, but you're giving me and Brenda an opportunity to spread this message via the podcast, which I'm a huge fan of. We want more people to somehow spread the word to lean practitioners all across the world, from Japan to Australia, Europe, North America. We want more people to hear this message. And number three, if possible, to contribute to our foundation in North America, which is the Capona Foundation. So the Capona Foundation, and we'll give the links to it after, I'm sure, Mark, is basically CCBRT in America. And that's our way, if people are interested in contributing to that, to help financially compensate any lean practitioner or developer or people who wants to come here for a period of time, that we want to make that in a way that they don't lose out any money. So that's my appeal to people. The humanitarian need is desperate, but I thank God every single day for bringing me here. But I know the biggest impact that I can make in my short time here on Earth is not necessarily the work that me and Brenda are doing here in this small organization in Tanzania, but it's in influencing people around the world to get involved. And that's the message that me and Brenda want to share with your listeners today, that we desperately need help. We need people to come here. We need people to spread the word. We need people to contribute to our foundation that can compensate people that want to come here, and to be involved in what I consider the most meaningful and satisfying work that I've ever done in my life. And once again, I from the bottom of my heart, Mark, I thank you for giving myself and Brenda the opportunity to share with you today.
Well, Michael, thank you for sharing what you're doing and that appeal for help. People go to the page for this episode. If you go to leanpodcast.org, you can find a link to the blog page for this episode. You can find links, for more information about CCBRT and how to potentially donate and how to help. Dr. Brenda, do you have any final thoughts or comments you'd like to share as we end here?
I just want to thank you, Mark, for this opportunity, and I'd like to thank Michael for coming into Tanzania and leading the way. And I personally am deeply grateful to him for the change in my thinking. And I know that this has forever changed the way I will be a trainer and I will be a doctor. It's forever changed me, and I'm excited about spreading that. So I have nothing to add to Michael's passionate plea, and I just would like to resonate that we really do need people, because Michael has a lot of work to do for CCBRT and moving the organization forward. So he would need not only more backup help for helping with the work, but also for him to be refreshed. So having given him an opportunity to work with his peers and other lean leaders will help refresh him, because this is a big task ahead, and I wouldn't want him to burn out.
No danger of that, Brenda. No danger of that.
Well, thank you, Dr. Brenda, Michael. Thank you so much for taking time to be a guest today. It's amazing the wonders of Skype and technology that we can make this conversation happen. And thank you for being with us today.
Thank you so much.
Thank you, Mark.
Thanks for listening. This has been the Lean Blog Podcast. For lean news and commentary updated daily, visit www.leanblog.org. If you have any questions or comments about this podcast, email Mark at leanpodcast@gmail.com.